A major legislative issue that you will be discussing during your Hill meetings is the Medicare Home Health Flexibility Act. This is legislation to address a lingering CMS regulatory issue. As you know, CMS administers the Medicare program, which includes home health benefits for seniors. Your lobbying goal will be to increase support for this bill. As you know, Congress monitors and can change the Medicare program, and that is why we are working on the Hill to address this problem. You should start your meeting by providing background on the issue. Occupational therapy practitioners are effective and important components of any home health agency's patient care and administrative team. Occupational therapists are qualified to perform rehabilitation assessments with their focus on functional capabilities. You should describe some of the services that you provide, especially in the home health setting. Let them also know that this is not a scope of practice issue. This is basically a regulatory issue where you'll be able to provide services that you're already well qualified to provide. You should discuss the issue with the staffer that you meet with. OTs are not permitted under Medicare to make the initial home health assessment or complete the required first comprehensive assessment. This is an obvious problem and one that AOTA has tried to address with CMS through the years to no avail. That is something that you might point out to staffers who ask why we don't take a regulatory approach and work with CMS to adjust this problem. Why is it a problem? The discrepancy causes unneeded inefficiencies and barriers to home health service. Obviously, if a OT cannot be the first person in the door, that can cause scheduling problems for a home health agency and ultimately delays in services for the people who need it the most. This can be an especially difficult problem in small towns and rural areas where there are not as many home health agencies, and that is a point you might want to bring up to representatives from regions such as this. You should discuss the solution to the issues which you have discussed already during your meeting. That solution would be passage of the Medicare Home Health Flexibility Act, which would allow OTs to open home health therapy cases and conduct the initial assessment and first comprehensive assessment. This would effectively resolve the issue for CMS. If you are in a Senate meeting, you should mention S-977, which was introduced by Dean Heller, Republican from Nevada, and Ben Cardin, a Democrat from Maryland. Obviously, this is a bipartisan bill, which is important given the need for both Democrats and Republicans to work together to pass legislation. In the House of Representatives, we are working to secure the final champion for the bill, and it is likely to be introduced within the next few weeks, certainly in September before your meeting. As of now, Representatives Ryan Costello, Republican from Pennsylvania, Patrick Meehan, a Republican from Pennsylvania, and Lloyd Doggett, a Democrat from Texas, are planning to introduce the bill, along with support from one further Democratic champion. As you see, this is also a bipartisan bill. That fact will, of course, not be lost on the staffer you meet with. There are a few key points you are going to want to make during your meeting with the congressman, senator, or staffer. Number one, the legislation was given a 0 score by the Congressional Budget Office in a previous Congress. This means that passage of the bill would not increase government expenses through the Medicare program or in any other way. Number two, the bill applies to rehabilitation-only cases, which means that if nursing were part of the mix, that the bill would not apply. Number three, and of great importance, the bill has received support from the broader community's major stakeholders in the home care field, physical therapy field, speech pathology, and nursing. This is critical as legislation that has wider support is much easier for Congress to pass than legislation which is opposed by various groups. Before you leave your meeting, you should remember to ask for the support of the congressman either through co-sponsorship of the bill or to thank him or her for supporting the bill in advance.